All right, we'll be talking about anencephaly, right? And under anencephaly, we'll be looking at various pictures that will help us remember anencephaly. We'll be looking at the definition of anencephaly. We'll be looking at the symptoms of anencephaly. We'll be looking at causes of anencephaly. I'll be looking at the prognosis, okay? Possible treatments, if there is anyone at all. Right? So, guys, what is anencephaly? Okay, anencephaly. Our focus today is to discuss anencephaly. What is anencephaly? And from here, just from the picture, you could see that anencephaly, the brain is so small, right? So there's a small brain tissue, right? Anencephaly is a rare condition that affects the formation of the brain and the skull during embryonic development. All right. So here are some key points to actually note about anencephaly. I'm talking about the definition and everything. All right. Definition: anencephaly involves the absence of a major portion of the brain, skull, and scalp. Okay. It occurs due to a neural tube defect. Okay. That's when the rostral, that's the head end of the neural tube, fails to close. Okay. So typically it occurs between the 23rd and 26th day, okay, following conception. This is when the rostral end of the neural tube is supposed to actually close, okay. So if it fails to close, it will follow up and result into anencephaly, okay. How about the brain tissue? Strictly speaking, the term translates as without a brain, okay. Anencephaly means without a brain, okay. But most of the children, they have brain tissues but small, okay. So however, children born with anencephaly usually lack a telencephalon, which is the largest part of the brain responsible for cognition. All right. So an anencephaly child will not be able to recognize anything. So the remaining structure is often covered only by a thin layer of membrane, okay, as skin, bone, or meninges are absent, okay. So it is just a membrane layer that is covering the exposed thin tissue of brain, okay. What are the symptoms of anencephaly? We said that babies born with anencephaly are usually blind, okay, because the telencephalon is responsible for cognition, right? So babies born with this will be blind. They will be deaf and they will be unaware of their surroundings and they will be unable to feel pain. All right. Now, reflex actions such as breathing and responses to sound or touch may occur, but the lack of a functioning cerebrum prevents awareness of the surroundings. Okay, you can see this picture. This is newborn baby having an encephaly. This one, all right. The skull is supposed to be this size, but it is becoming so small. All right, because of the failure of the rostral neuropore to close. All right, so you can see this is a fully developed newborn having no problem. What are the causes of anencephaly? We said that it's basically folic acid deficiency. Folic acid deficiency has been linked to neural tube defects, including anencephaly. Now, ensuring sufficient folic acid intake is crucial for a pregnant woman to reduce the risk of their baby coming down with anencephaly. Okay, so now all women of childbearing age are recommended to consume 0.4 milligrams of folic acid daily, especially those planning to conceive. Okay, now waiting until pregnancy has become maybe too late to prevent anencephaly. All right, so this is basically prophylactic treatment where you're actually taking the folic acid so that it can actually prevent the occurrence of anencephaly. And if I'm not forgetting, folic acid is vitamin B9, okay, something like that. All right, so what is the prognosis? Basically, sadly, infants with anencephaly do not survive longer than a few hours or days after birth. Okay, now death typically occurs within hours to days after delivery. All right, now this to tell you that the brain is actually a delicate and important structure, and anything that is reducing the size of the brain is deadly. Okay, it's threatening to life. Okay, so guys, that's it about the concept of anencephaly, which is basically um, uh, congenital anomaly that affects the formation of brain and skull. Okay. All right. So guys, that's it about the concept of anencephaly. See you guys in the next tutorial. Bye for now.